A video summary of the original blog found here. https://bmidoctors.com/comprehensive guide to A1C. Imagine a test that reveals your blood sugar control over the past 3 months, giving you a crystal clear picture of your diabetes management. This is the power of the A1C test. The A1C test, also known as HbA1c, measures the average level of glucose attached to hemoglobin in your blood over the past 2 to 3 months. Hemoglobin is a protein in red blood cells that carries oxygen throughout your body. When blood sugar levels are high, glucose binds to hemoglobin, forming glycated hemoglobin. The A1C test measures the percentage of hemoglobin that is coated with sugar. The higher the A1C level, the poorer the blood sugar control and the higher the risk of diabetes complications. Diabetes is a chronic condition characterized by high levels of sugar in the blood, primarily due to either the body's inability to produce insulin or resistance to insulin. Monitoring and managing blood sugar levels are crucial in reducing the risk of diabetes-related complications such as heart disease, kidney failure, and nerve damage. The A1C test serves as a key indicator in this management process, helping both patients and healthcare providers understand how well blood sugar levels are being controlled over time. Unlike daily glucose tests, which only provide a snapshot at a single point in time, the A1C test offers a comprehensive view of blood sugar control. This long-term perspective is essential for making informed decisions about the management of diabetes, including adjustments in medication, diet, and physical activity. The American Diabetes Association recommends an A1C goal of less than 7% for most adults with diabetes, but this target can vary depending on individual circumstances. Achieving and maintaining the target A1C level is associated with a significant reduction in the risk of diabetes-related complications. Over the years, the role of A1C testing in diabetes management has evolved, becoming a benchmark for adjusting therapeutic strategies. The A1C test is a simple blood test that can be performed in a lab or a healthcare provider's office, and it does not require fasting. During the test, a small sample of blood is drawn from a vein in the arm or, less commonly, from a fingertip prick. The sample is then analyzed to determine the percentage of glycated hemoglobin, indicating the average blood glucose level over the past few months. The results of the A1C test are expressed as a percentage. For instance, an A1C level of 6% means that 6% of the hemoglobin in your blood is glycated. The American Diabetes Association provides general guidelines for interpreting these percentages. Normal is below 5.7%. Pre-diabetes is 5.7% to 6.4%, and diabetes is 6.5% or higher on 2 separate tests. While the A1C test is a valuable tool, certain factors can influence its accuracy, such as variations in hemoglobin type, conditions affecting red blood cell turnover, and certain medications. The A1C test is also used in the diagnosis of diabetes. An A1C level of 6.5% or higher, confirmed by a second test, typically indicates diabetes. For people with diabetes, maintaining an A1C level within a target range is crucial. The ADA generally recommends a target A1C level of less than 7% for most adults with diabetes. Some laboratories also report an estimated average glucose, EAG, along with the A1C percentage, translating the A1C percentages into the same units as everyday blood glucose meters. Regular A1C testing helps in making informed decisions about treatment adjustments, such as adjusting medication dosages, introducing new medications, or intensifying lifestyle interventions. High A1C levels over time are associated with an increased risk of diabetes-related complications, such as neuropathy, nephropathy, retinopathy, and cardiovascular diseases. The frequency of A1C testing is tailored to individual needs and can vary depending on various factors, including the type of diabetes and the stability of blood glucose levels. The American Diabetes Association offers general guidelines for the frequency of A1C testing, recommending twice a year for stable type 2 diabetes and every 3 months for type 1 diabetes or unstable type 2 diabetes. Effective communication between patients and healthcare providers is crucial in determining the appropriate frequency of A1C testing. While A1C testing provides a long-term view of blood glucose control, it is not a substitute for daily blood glucose monitoring, especially for individuals using insulin or those with type 1 diabetes. Managing A1C levels through lifestyle changes is a cornerstone in the treatment of diabetes, including dietary changes, regular physical activity, weight management, and stress management. The interpretation and management of A1C levels can vary significantly across different populations, such as children, pregnant women, and the elderly. Advancements in medical technology and research are continually shaping the future of A1C testing, including non-invasive testing methods and integration with continuous glucose monitoring systems. The journey through the world of A1C testing is one of continuous learning and adaptation, essential for providing effective diabetes care and ensuring that treatment plans are tailored to meet the unique needs of everyone. Stay informed, stay proactive, and take control of your diabetes management. Remember, your health is in your hands. Keep watching for more insights and tips on managing diabetes effectively.